I'd like to take a moment to share a little piece of me that will help explain why I believe that everyone deserves a family doctor. 10 years ago, I was traveling in my minivan with my whole family when my cell phone rang. It was a pediatric neurologist on the other end of the call. He said to me, "Mrs. Currie, are you sitting down?" It was one of the scariest moments of my life. That was when he told me, "Your son has had a stroke." I turned my head to look at my beautiful, precious 4-year-old boy sitting in his car seat, grinning from ear to not quite ear. And then it all started to fall into place. My concerns about him not using his left hand for much, his adorable crooked little smile, his inability to feed properly as an infant. And then I felt angry and afraid. Fear about what my son was going to have to face and what this meant for his future. While it had taken us 4 years to get to the answers, the only one who ever truly heard my concerns was our family doctor. Maybe he missed the stroke, but I never faulted him for that. After all, it's only 1 in 3,000 births that have a stroke. What I cherished about this man, this family doctor that became such a support to us, was that he was the one that pushed forward with me when I said, "Please, you need to help me figure out what's happening." He helped us get to the specialist that ordered the MRI that diagnosed my son was missing 1/3 of his right lobe. Without our family doctor, this may never have happened, or the diagnosis would have been later, and treatment would have been further delayed. What happens to those kids out there right now, today, tomorrow, next week? They can't find out they've had a stroke because they don't have a family doctor to help them get those answers. When my daughter was 6 years old, she woke up one morning, unable to stand. She collapsed to the ground, screaming in terror. I rushed her into our pediatrician's office in Alberta, where they saw her immediately versus waiting in an ER. They diagnosed her with viral Guillain-Barré. For months after that, we saw her develop more and more health problems. We worked closely with our pediatrician and family doctor to have her referred for a variety of tests. Results would come back abnormal, but significance unknown, or normal. It was an exhausting time for everyone, but the consistent support from our family doctor and pediatrician was what got us through it. We dealt with many unknowns and some medical professionals that didn't invest in our children the way our family doctor did. At one point, a neurologist sent a letter to our pediatrician and our family doctor after meeting our daughter only once, and it stated, "Child was normal, except for difficulty to elicit knee reflexes and minimal ankle reflexes. It is unlikely that this child has any underlying physiological abnormalities. In general, I believe these are both healthy young children. Mom seems to be quite anxious about their health care, but denies that fact. I wonder if there is not some transference of her anxiety to the children, and if she can be persuaded to look for avenues for parenting." This type of treatment and statement can injure on so many levels. It can injure the person it's written about. It can limit the efforts taken to help the child in need. It can influence future interactions with other professionals that see that letter. Parents that must press on after being shut down by specialists need the support of a family doctor like all of you here today. I can admit I was concerned about my children's health because that was a normal reaction as a caring parent. But what I was not was a questionable parent. And this specialist made me feel that way. He made those judgments of me, and he didn't even know me. He'd met me once. When we moved to BC, it was a truly caring physician asking questions that resulted in my children being referred to BC Children's for extensive testing by genetics and neurology. Within 6 months, my children and my husband were diagnosed with a rare gene mutation that can be life-threatening. We were able to link most of the health problems both children and my husband had experienced to this gene mutation, including my son's stroke and my daughter's Guillain-Barré episode. But we never would have gotten to that stage if we hadn't had a doctor seeing our children regularly, monitoring changes in their bodies, getting to know our family, observing all of us, and one day noting my husband had the same muscle movement problem as my daughter. It is her observations over several appointments that changed the course of my children and my husband's lives. It was her consistency of care that may have actually saved my family. We quickly learned that my 3 beautiful family members are the only ones recorded in the world to be alive with this mutation. Doctors make mistakes. Doctors miss things. You're not perfect, and no one should ever expect you to be. But as a family physician, you make a commitment to be at your patient's side and continue to look for the answers with them. Specialists can come and go, but you remain. You might not get it right the first time, but what counts is that you are there to keep trying with them. What counts is if you give that parent's concerns the merit they deserve where others cannot or choose not to. So ask me if I understand the value of longitudinal continuity of care. Ask me if I believe that everyone deserves a family doctor. My answer is a resounding yes. A physician that knows you, that monitors you for changes, that recognizes patterns or inconsistencies in your health is irreplaceable. Irreplaceable, government of BC. And over 1 million BC residents don't have that. I am driven every day by my concern for all the children out there that don't have the answers we now have. And for the parents that have valid concerns about their children's health, but have no family doctor to support them in this system. It is hard enough to be a parent navigating the world of social media, filled with those who appear to know better than you, or the scary realm of Dr. Google, where you can be instructed from one extreme all the way to the other. Parents need the support of a family doctor who can help guide them in the care of their children. Specialists have a skill set. Nurses have a skill set. Acute doctors have a skill set. But none of them replace a family doctor. The family doctor is the foundation of our healthcare system. Each of you are part of that foundation. And without you, the whole system crumbles. You chose family medicine because you want to provide cradle-to-grave care. No other specialty offers that, only you. So you may now be asking yourself, how do we get to a system that is equitable for those working in it and for the patients in the system? We advocate. We use our words, our stories, our skills to inform the entire province, the entire country, about why everyone having timely access to a family doctor needs to be the #1 priority. We advocate for the seniors that can't do it for themselves. We advocate for the unborn children that don't even know how much they will need you. We advocate for an equitable system for all.
BC Healthcare Matters is a not-for-profit society fully funded by donations. We have no alignment to any political party.